Real news for Americans 50 plus. This is Emeritus News Channel.
Jenny Backus with the HHS Public Affairs team, and welcome to Know What to Do About the Flu, a web series launched by HHS to distribute timely and accurate information straight to you. Everything you need to know about the flu, from the seasonal flu to the new H1N1 virus. Our goal is to get you the latest facts and important medical guidances so we can all be more effective in combating the spread of the flu and be better prepared should our families, our communities, or our workplaces become affected. Since the H1N1 flu virus was discovered in April, the federal government has mounted an aggressive response, including ongoing communications with hospitals, healthcare professionals, schools, parents, patients groups, and key leaders in Washington and around the country. Early in July, HHS hosted a flu summit to kick off a nationwide fall flu preparedness effort, where federal employees and officials laid out specific ways that state, tribal, and local governments could start planning and preparing. Shortly after that, we launched the Know What to Do About the Flu webcast series to reach out directly to Americans, to you at home, through our website, www.flu.gov. Working together with agencies across the government, like the Department of Education, the Department of Homeland Security, the Department of Commerce, and the Centers for Disease Control, we've also been rolling out important guidance for health professionals and everyday citizens on topics ranging from guidance for schools and institutions of higher learning to guidance for businesses and employers for the fall flu season. You can find all of these on our website, www.flu.gov. Today we'll be discussing another aspect of flu preparation, what pregnant women and new parents can do to combat the flu, both for themselves and for their families. Earlier today, Health and Human Services Secretary Kathleen Sebelius and Tchen, Executive Director of the White House Council on Women, joined us in the studio. Let me first ask you, Secretary Sebelius, why is it important to have a webcast for pregnant women and new parents?
Well, we learned a lot about the flu during the spring and summer, and one of the issues that we now know is that for whatever reason, pregnant women are particularly susceptible to being seriously ill and potentially dying from the H1N1 virus. They represent about 1% of the population and yet represented about 6% of the patients who ended up in the hospital and 6% of the deaths. So getting a vaccine for pregnant women is a way to really protect and insulate pregnant moms from getting seriously ill or, in the worst case scenario, dying from the H1N1 virus.
Now, there's lots of phone calls, you're seeing lots of webcasts, you're seeing lots of cabinet secretaries out. Ms. Tchen, from the White House's perspective, what is the federal strategy for this?
Well, the federal strategy that the President's outlined is for us to be coordinated, to be aggressive in getting the word out. And so that's why you've seen from the White House, from all the cabinet secretaries, not just Secretary Sebelius, but across the entire federal government, a lot of activity on trying to make sure that all of our public around the country knows what's going on, that we're well coordinated with state and local governments, and that we're prepared to respond quickly, because the other thing we know about the flu is that it's unpredictable. We don't know what will happen. We're trying to be ready for whatever turn the flu might take, and that we can get the word out to folks.
Now, you're both federal officials, but you're also both parents, and you know lots of people who are pregnant or new parents. What are you telling your own friends and family about this right now, Secretary?
Well, I think it's important to have a conversation with a doctor about the steps that could be taken. This vaccine is going to be very much like seasonal flu vaccine, and what we know is that pregnant women have taken seasonal flu vaccine for years. So although this virus strain is new, the preparation is identical. Tests are going to be conducted in the next couple of weeks to make absolutely sure there are no adverse effects. But I think on balance, protecting yourself and your baby, making sure that you stay as healthy as possible during a pregnancy will not only involve hopefully, keeping your hands clean and staying home if you're sick. But also, what we know is vaccinations are the best possible way to protect against this virus and future viruses.
Now, I know we talk about younger people and this flu being a younger person's disease. Is there anything special, Ms. Tchen, that you would say to younger people about this vaccine and virus?
Well, I think, first of all, let's start with the basic prevention techniques of hand washing, covering your mouth when you cough, urging your fellow students and friends to do the same, and staying home when you're sick, having a plan for what to do in your family. If someone gets sick, who's going to care for folks? What is the plan going to be if someone gets sent home from school because they're sick? And then get vaccinated, and not just the H1N1, but also seasonal flu, and the seasonal flu vaccine is available now, and people should be getting that vaccine now.
Well, this is a really hot topic, obviously, and we've been getting some questions from viewers in advance. John from Alexandria wrote in and said, my wife's going to have a baby in 6 months. We're going to be new parents. What can we do are we in the priority group, and sort of what can we do to make sure our baby's okay?
Well, first of all, John, congratulations. It's exciting. My boys are 25 and 28, but I still remember those early days very well. Get some sleep along the way, but absolutely plan to get vaccinated. The vaccine is not recommended for infants under 6 months old, but the so-called cocoon effect, what we want to do is encourage caregivers, nannies, grandparents who are caring actually for the infant, and certainly parents, to get vaccinated. That's the best way to not only protect the caregivers, but certainly to protect the baby.
Now, Rosemary from New York City has emailed in, and she wants to know, are there any materials or things that are available, and also, are they available in multiple languages?
Well, the important place to go and to stay current and up to date on the information is our website, www.flu.gov, and that will have not just what the information we're talking about today, but as we move through the flu season in the coming months, it'll have the most current information, so people should check back often. If they're part of an organization, there are widgets there that they can use to make the link to flu.gov. We've got materials to download. Flu.gov is automatically translated into Spanish, so we have sort of side-by-side for everything that's on flu.gov in Spanish. And we have some additional languages like Chinese and Vietnamese, and if folks need that material, they can get in touch with the HHS Public Affairs Office.
Great. Now, there has been a couple of questions about that. We keep hearing that H1N1 is like seasonal flu. It's mild, not that many people are dying. And there's a question that's out there, is the government overreacting to this? Secretary?
Well, what we know is it's brand new, and that no one really has an immunity to this disease. For whatever reason, the oldest Americans, people over 65, seem to be a little more resilient, and no one is quite sure exactly why that's happening. But the rest of the population is very susceptible because this virus hasn't been circulating before. So we could have a lot of illness, and unfortunately with pregnant women, with kids who have asthma or neuromuscular disorders, with older Americans who have some underlying health condition, people can get very sick and potentially die. So again, what we know is vaccination is the best possible defense against this and other viruses. So preparing to get a vaccine, but in the meantime, we need to take steps to not circulate the virus. So hand washing, as simple as that sounds, is effective. Wiping down keyboards and doorknobs, any place that hands come in contact. And then if folks are sick, please stay home, because you don't want your child sharing this with classmates and playmates. We don't want to make other folks ill. But staying home requires, as Tina has already said, a backup plan. We need to have employers begin to think about how employees can stay home, be encouraged to stay home, and not be penalized in a job. Parents to have a backup child care plan. Colleges to make preparation to move kids out of a multiple living situation. You know, if you've got a dorm room with 4 people in it and one gets sick, where can the sick student go to get better and not infect the other 4? So those strategies need to be prepared for right now.
What you're seeing on your screen right now is a very helpful guide that you can find on flu.gov, which is a guide for parents. It should help parents with some basic questions, and it's also downloadable so you can move it on to people. Well, thank you, Secretary Sebelius from Health and Human Services, and Tina Tchen, the Executive Director of the White House Council on Women.
Thank you.
Nice to be with you.
Thanks.